see here, right here is the pillow. So it's covering up the breast tissue, and then we've got the sheet covering up the pelvic region, of course. And you can even go like this. And if you need to, just ask permission to put your knee up on the table so it's a little bit more comfortable for you. If the belly's hanging down too much, what you can do is even put like a half bolster or a towel underneath this area just to raise it up a little bit. And this way you can really get into the rib area. Or even if they're having a little bit of lower back problems, the quadriceps right here, you can really nicely get into that area. Or even to the side. And you can even perform a little bit of a stretch. So you can hook the iliac crest here and kind of glide up. Or you can even just hold it too if you want to stretch. So if they're having any kind of side problems. And this can even be used for the average person too, the side lying position. So you can get at these areas a little bit easier. And with the abdominal, you can just kind of pull it up. Or you can go one hand on one side, one on the other, kind of lift it up. And earlier I talked about using cocoa butter, lotion, and you can even use some of that to massage during this time too. But again, ask permission, because sometimes with scents, sometimes that can trigger them being nauseous or them wanting to throw up, any kind of sense. For my wife, when she first got her prenatal pills, she hated them because they smelled kind of like vanilla, and she started gagging right away whenever she took those, so we had to make sure we got a different batch the next time around. So again, any kind of little smells. And for her pregnancy, she actually threw up and was nauseous the whole pregnancy. So in general, it's the first trimester for motion sickness, that kind of problems. But again, not everybody has it throughout, but some people will have it more in the mornings, other ones more in the afternoons. But again, it's called morning sickness, but don't let that fool you at all. And you can even perform like an ocean wave right in the abdominal region too. Even kind of a crisscross. One hand going one way, the other one going the other way. And you can perform hand underneath, so you can get right at the quadriceps, of course. Or even use your forearm a little bit in this area. Some petrissage. And massage is actually good for a pregnant woman too, so it helps regain the lactation. So it helps everything form a little bit better too. And the biggest area that they're going to have stretch marks if they do is the abdominal region. So you can ask permission to just perform a little bit lower abdominal. And again, most of the time when you're massaging the abdominal region, the baby's going to fall asleep. So you don't have to worry about the baby kicking you at all. And if you need to, you can just place your hands on them for a little bit, just to see if the baby is awake. Or if the baby's a little bit awake, this sometimes might calm them down a little bit. Just got kicked a little bit there. Okay, so that concludes this area. Now we're going to go to the back area when she's laying on her side.